Beware clinics, this video is for you. Soon, your physicians will expect this from you, or they will simply choose other clinics. So you might want to stick around. Here at AI Signals, we analyze industries and how AI is disrupting it. We try to focus on everything that addresses mundane, repetitive tasks and how they prevent a smooth operation. A couple of months ago, I went to the emergency in a hospital near my home. And I don't know why, but that day I looked around and I realized what technology was doing. I saw a counter with many desks and computers behind, and maybe I recall about 7 or 8 people behind their computers. There were doctors writing reports, there were nurses, and there were also a lot of administration staff doing the planning and responding to messages. And I felt something was wrong because they sent me to this bed, and then a doctor came to see me, asked me 3 questions. It literally took 2 minutes, and then she went back to her seat typing on her laptop. And I just thought that was wrong. I think today what AI is bringing is the opportunity that it's bringing is incredible. Today we're not going to talk about hardcore healthcare advancements like in imaging or robot surgeons, but simply about that admin function. What I love about this topic is that the purpose of AI is not to cut costs or to let people go and so on. It's simply to improve the quality of healthcare and to improve the quality also of the life of the healthcare providers. So it's a video that's really dear to me, an industry that's very dear to me. So you probably already know it, but physicians don't like paperwork. They do it, they have no choice, they need to keep records in their system, they need to write letters. This is just part of their jobs, but over the past couple of years, it has become too much for them. According to many studies, doctors spend in average 25% of their time doing admin work. That's like on a 8-day workday, that's 2 hours a day doing paperwork. It's a lot of time. And for a lot of them, this is really not what they've signed up for when they went to medical schools. As a matter of fact, today, those physicians experience a lot of burnout. The burnout rate is soaring. For a lot of them, they decide to go on early retirement because it's just too much. And at the same time, today, seeing a specialist is incredibly challenging, especially in places like Europe. I know, like for my family who lives there, if they want to see a specialist, it might take somewhere between a month to 6 months sometimes. It's a really long time, and that's mostly because there's a clearly aging population that requests more specialist treatments. So this is a really big challenge. On one side, you've got these physicians who are tired and overwhelmed, and on the other side, you have this increasing demand of an aging population. I believe the impact that AI can have can be really positive here. Today, I want to talk about a specific piece of technology that has already been tested since 2023. It's been quite some time, but we are yet to see it deployed massively. So I want to share with you some of the latest advancement in technology that make it even more possible to deploy that technology, which is what we call ambient AI. Ambient AI is this device that you put on the consultation or on the table on your desk as you speak to your patient, and that would simply listen and record the conversation, take notes, and help you prepare as a physician the different documents or all the admin tasks that you need to complete by the end of each consultation. Today, there have been a tremendous amount of progress that have been done, including in terms of user experience. In the places that these systems have been tested, they have put in place a simple consent system where the doctor, before they would record a patient conversation, a consultation, then they would ask the patient, would you be okay to be recorded during this session? And they would explain the purpose being more present, not having to type on the laptop as you talk to your patient. And this hospital called the Cleveland Clinic that has been testing it since 2023, that some of their doctors report a very, very small rate of decline for this request. Most people decide to embrace this new technology so that they can get the doctor's full attention. In April 2026, you had OpenAI launching ChatGPT for clinicians. In January, earlier this year, 2026, OpenAI launched OpenAI for healthcare with audits, encryption, HIPAA, HIPAA support, and some enterprise governance. You had Amazon launching the Amazon Connect Health in March 2026. Essentially, a lot of these big companies, these frontier companies, are seeing the need for AI in healthcare, not necessarily, like I said earlier, in the hardcore tasks that AI could do, but simply in the administrative work. So what we are discussing today is, just think about it this way. Your physician spends 2 hours a day doing admin. What would they do with that extra hour? If only you could save like an hour a day of admin work, because you have these systems that allow to capture a lot of their notes, a lot of their thoughts quickly, a lot of the conversations, and prepare letters on their behalf. Of course, like, it became increasingly important that physicians remain in control. The idea is not to replace them, it's really to give them the tools to make their admin life easier. So what would you do, or what would they do with that extra hour? Would they just spend more time with their patients? Would they be able to see more people? It's really what's at stake now, and it's a beautiful moment. This is where the technology is supposed to be, besides us, helping us in our tasks, but without intruding, without putting itself in between us, especially in healthcare. So it's a great moment that we are seeing, and we hope many clinics embrace this new technology. Thank you very much for listening. Hopefully that was interesting for you, and we'll see you again each other in 1 week. Have a nice day.